There is a shortage of healthcare workers across our nation, and new research shows it is likely only going to get worse, especially in rural areas. And that's where Steve Beard comes in. He's the CEO of Adtalem, the largest healthcare educator in the U.S. Steve, good morning to you. I do want to learn more about your plan to remedy this issue to the extent that you can, but I also want to ask you about the new name for your company, a little bit of a rebrand as of this morning. What can you tell us about it? Good morning.
Sure. Good morning, and thanks for having me. Today we are Covista. It is a name that we think recognizes what we've built over the last 4 or 5 years in transitioning to become the country's largest healthcare educator. And it also reflects where we're taking the business going forward as we look to take a more authoritative voice in helping to solve some of the chronic workforce shortages that bedevil healthcare. So we're really proud of the name. We're proud of the repositioning. We think it reflects who we are. And the research that we put out here today is a reflection of how we think about contributing to the conversation around healthcare.
Yeah, and some of that research that you put out today talks about just how serious this workforce shortage is. Give us your thoughts on the state of the healthcare workers and just how much worse could it get?
Well, we come into 2026 with a large gap between the supply and demand for clinical talent. That's only growing, but I think what is most important in the research we've done is the extent to which that represents a care quality issue. We talked to 160 healthcare leaders. We talked to over 1,300 clinicians, and all of them cited the workforce shortages as the basis for a diminished level of care for all Americans, and that's something we should be concerned about.
Are some areas hit harder than others? I think about here in Georgia and Metro Atlanta. What do we know about what our neighbors are experiencing?
Yeah, Georgia faces one of the most acute staffing shortages in the country. They've got 40% more vacancies than the national average, 3.3 vacancies for every job seeker, and you compare that to a 2.3 national average. So a real challenge in the state of Georgia and in Metro Atlanta. And so for a state like that, that's populous, that's growing, that has both rural areas and urban areas, getting creative around the solution for clinical talent becomes increasingly important.
I want to get to the solution in a minute, but let's continue diving into what we're experiencing right now. Why aren't more people becoming doctors and nurses?
It certainly isn't for a lack of aspiration or desire. Folks are called to these professions. Many physicians, nurses, social workers, they've wanted to be that kind of professional since they were children. The real challenge is that the pipelines into those professions, as stood up by traditional higher education, haven't expanded to meet the needs of either the aspiring student or the healthcare systems that need them. And so we've got to think creatively about how to broaden that pipeline, create opportunities for more of those aspiring clinicians to fulfill their professional dreams, and deliver the kind of workforce that we're all going to rely upon here in the U.S.
Would you say that you are an alternative to the traditional higher education? Where exactly does Adtalem and now Covista, where do you fit into the story here?
Well, we certainly believe we're a part of the solution. We are the largest healthcare educator in the United States. We have 97,000 students, 380,000 alumni. We graduate 24,000 clinical professionals every year, and we're the leading producer of nurses, physicians, social workers, clinical psychologists, and veterinarians. So we're a large part of the solution, but as we go to market as Covista, we're really looking to scale up even further and to make a bigger and more outsized contribution to the supply of day one ready talent for U.S. healthcare.
Yeah, I was reading through some of the numbers that you just put out this morning, and Steve, we're showing your website here. I encourage folks to go there and read the research for themselves. But you found more than 700,000 healthcare job openings every month, but only about 300,000 unemployed workers to fill them. I mean, if that demand is so dramatically outpacing supply, do you think this is something we can realistically train our way out of?
Well, I think that absolutely has to be part of the solution. There's no substitute for more people at the bedside serving patients. Now, we do think technology will play a role. In our survey, we collected data on how both leaders in healthcare and clinicians thought about the role of artificial intelligence. And I think there's a fair degree of confidence that it will go a long way towards alleviating the administrative burdens that healthcare workers struggle with every day, giving them more time to serve patients and giving them the opportunity to practice at the top of their license. But that alone won't solve the problem. In addition to focusing them on the highest value work, we just need to get more and more of them into the system. And that becomes increasingly important given the demographic trends in the United States, where we've got an aging population that's going to rely on healthcare like never before.
You mentioned AI. Is it fair to say that artificial intelligence likely to help with maybe alleviating some of the paperwork that doctors have to go through now versus having a robot at my bedside reading test results and making diagnoses?
Well, I certainly think that AI will augment human clinicians in a way that makes them more effective, that makes them more productive, and that allows them to do those tasks that only humans can do. At the end of the day, what we know about the art and science of healing is that there's no substitute for the human connection between provider and patient, and no technology will substitute for that. That having been said, there's a ton that technology can do to give time back to clinicians to spend time with all of us as we rely on them for our health and our well-being.
And you kind of mentioned it a minute ago, too. We got baby boomers aging. I mean, you got to just think about the health requirements they're going to have in a few years. Doctors becoming of retirement age. I mean, it seems like a lot of reason for pessimism, but do you have any glimmer of hope looking down the road to where we can alleviate the worker shortage, say, 10 years from now?
I do. Look, I think the problem is increasingly well understood. I think healthcare providers are increasingly creative in thinking about workforce solutions for their systems. And I think higher education is increasingly focused on ways to expand that pipeline. In the meantime, here at Covista, we're working on growing our programs, expanding geographically, and really leveling up the number of clinicians we deliver to the U.S. market every year. As I said, we graduate about 24,000 today. We believe we can do much, much more of that going forward.
Steve Beard, CEO of Covista, as of this morning. We certainly appreciate your time. Fascinating conversation, and let's talk every so often, get some updates on progress here.
I'd love that. Great to be with you.
All right, Steve. Thanks. Steve Beard.